This is the second video on general anatomical terminology, and this one will deal more with internal structures in the body, like body cavities or the way that your body's divided up internally. Now, body cavities, you're going to have several different ones we're going to look at here. They're mainly for support and protection. You know, you think of like the thoracic cavity houses the lungs and heart, which are very important organs, and it gives a protective rib cage all the way around them so that even like really soft tissue like the lungs probably won't come into harm's way very often. And let's take a look at all these, and let's start with that thoracic cavity. Over here in purple you can see a side view here of the thoracic cavity, and it's what you would consider your chest cavity, and over here it breaks it up into the different regions of this thoracic cavity. And remember, there's not structural divisions here. Basically, you're talking about one big space here, and there's a space here for the heart called the pericardial cavity. There's a space here for the right lung, which is part of the pleural cavity, and the left lung, which is part of the pleural. And then you have a space here at the upper side where it's where things like the trachea or the esophagus would pass through, and it's called the mediastinum. And collectively, all of this make up a big open cavity here called the thoracic cavity. And at the bottom here, you have a muscle, a thin muscle that stretches completely across the inferior side of the thoracic cavity, and it divides, for example, it serves as a division from this abdominal cavity here. So the thoracic and the lower side is boundaried by this diaphragm muscle, which you're going to see going to play an important role in your breathing process. And then the ribs and the tissue and muscle around them supply that provides the outer boundaries on the sides here. Now, the next cavity is the abdominal pelvic cavity here. That's the combination here of the abdominal cavity and the pelvic cavity. And once again, there's no structural separation here between the two. It's just all one big cavity. The abdominal cavity houses a good many of your organs. You're talking about, it has both the small and large intestines. It has the stomach, the liver, the gallbladder, the spleen, the kidneys. All of these are located there in the abdominal pelvic, or the abdominal cavity part of it. The pelvic cavity is at the bottom here that kind of sits in the bowl of your pelvis. And that's where your urinary bladder is. That's where the female reproductive organs are there. You have where the large intestine exits the body, passes through the pelvic cavity there. But collectively, these two are called the abdominal pelvic cavity. Now, we also have the cranial cavity that houses the brain here. Here's another view. And the spinal cavity. The spinal cord basically has its own cavity, and it runs through all of these different vertebral bones here, the vertebra, and down through the sacrum here at the end. And when you look at like if you look at a vertebra individually, you notice there's a hole in the middle of each one. Well, when you stack all these on top of each other, that'll make one continuous cavity there. All those holes collectively make up the spinal cavity. We're not going to spend a lot of time now on the body cavity membranes. We'll look at them, like, for example, with the respiratory system, or actually when we look at tissues, we'll look at what differentiates the different types. But mainly just know that there's going to be some of the membranes, the serous membranes, are going to make up linings, and they're going to line your body cavities or line different chambers in the body, or coverings. And the coverings are going to be a little tougher. They're going to be made with more connective tissue. And, you know, you're going to, like when you see the word pericardium, that's one of the covering for the heart. And you'll see different references toward these coverings as we look at the different organ systems, and we look at, almost all the different organs are going to have some type of covering. Now let's take a look at a way that you're divided. Your body cavity here are divided based on kind of how you're viewing it. If you're an anatomical viewing of it and you want to know specific, because you're getting very specific about structural and what's found where, you're going to probably use the body regions. If it's more of a clinical diagnosis and it's they're just trying to describe like where pain is coming from or something such as that, or sensitivity, they're probably going to use the 4 quadrants, even though they're both talking about this, dividing the same areas of the abdominal cavity here, abdominal pelvic. And if you look at it, you have 3 rows and 3 columns here. It's like a tic-tac-toe board with the body regions. And the ones I want you to know are the ones in the center region, the epigastric, the umbilical, and the hypogastric here. The other ones are pretty much self-explanatory. The right hypochondriac, remember, right side of the body versus left side of the body here. It's always the patient's right and left. The left hypochondriac, the left lumbar, right iliac, and left iliac. So, for example, if you were trying to, you were looking at where the spleen would be located, the bulk of it here would be located in the left lumbar region. And like I said, this is more for anatomical studies. Now, a clinician would be more, doctor or whatnot, would be more interested, for example, if you had pain down here in the right lower quadrant, that might signify that you're having an appendix problem. There's the appendix right there. So this is upper right quadrant, and once again, you can use these initials for it. It's lower upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. And they're more for, physicians' use there. Now, the very last one we're going to look at are divisions of your skeleton. When you see axial and appendicular, it actually can mean something else, but generally what you're talking about here, you're talking about the skeleton. If you note there in blue, you have the skull, you even have the bones of the inner ear, which are part of the skull, the vertebral column, the ribs, and the sternum there. These are your bones of your torso, and also at the bottom of the vertebral column you would have the sacrum as well, and the coccyx bone. But these bones here in blue make up the axial skeleton, and that's your trunk or torso. And the appendicular bones here in red are your bones of your appendages, and the connective points for those appendages. For example, you look at the axial skeleton here. These are all torso or core bones, and the appendicular are all appendage bones, or the harnessing the appendages. And if we look at for example, the radius and ulna here, the humerus, the scapula, the clavicle, the carpal bones and metacarpals and phalanges here, those would all be part of this appendage, including the connective points. And then that's where people would miss this on a test, for example, if they'd say, okay, is the attachment bone like a clavicle? Is that part of the appendicular or the axial? And we'll study these. We'll study these more when we take a look at the skeletal system. But for now, just know that if it pertains to the torso or the trunk, that's axial. If it pertains to the appendages, that's appendicular. Now that'll end this video on this video number 2 over general anatomical terminology.